Hi, this video is the demonstration of the FUT linear scar. Some result will be smaller, um, and some of the result of the scar will be wider, and it vary from one individual to another. Again, the result vary from one individual to another. This is the demonstration of the strip linear donor scar in the during the follow-up. Again, the scar stretch is dependent on a few factors. One is the patient genetic. Some patient genetic produce scar very small, and it makes the surgeon look better than he is. Some genetics will produce bigger scar than other, and that's due to genetic, and it makes the patient look worse. That's one factor. The other factor is how big you do the surgery. The bigger the surgery, like 4, 5, 6,000 grafts, the scar tend to be stretched a little bit bigger. Why? Because it's more tension when you close down. Because you have you cut a wider strip versus the smaller surgery. You cut a smaller, more narrow strip. Then when you close down, it's less tension. That's that's other part too. And then tricuspid closure is always standard. Again, result vary from one individual to another. So this is the demonstration of the strip method. Now, the strip method, not just linear scar, but FUT, but it's more invasive because we have to cut you open. That means more painful, more bleeding, more chance of infection. On the other side, the benefit of the strip is cheaper. You can move bigger amount of graft per day, like 4,000 or 5,000 graft per day. It's very effective for advanced hair loss. In terms of growth rate, you're gonna have excellent result with my work for FUE or FUT. Since I've performed both, but the FUT will be 5 to 10% better dense than FUE. On the other hand, the FUE does not leave a linear scar. The FUE leaves tiny dots of scar, allow you to shave your head shorter. The FUE, less invasive, less bleeding, less chance infection. It heals faster. But the downside of the FUE is cost. It's more expensive. The number of grafts we can do is less, 2,500 to 3,000. And the growth rate, you're going to have excellent result with FUE or FUT. But the FUE, when you compare my FUE to my FUT, is 5% less to 10% less than the FUT.